We are here with Marilyn Martin, who is we are proud to announce is our St. Clair's Employee Pride winner for 2010. And I guess first, Marilyn, can you start? What does it mean to you to be selected by a panel of your peers as our Employee Pride winner? Obviously, you take great pride in what you do here.
It's amazing. It's just wonderful. I can't describe it.
Obviously, we ambushed you a little bit today at your
did.
meeting, so we're glad you were able to share that with your colleagues. But I guess if you can tell me, some of the questions that we went through when they asked questions, like most notably is, was there something significant that happened to you that drew you into healthcare, and you've had a wonderful career with Ministry Healthcare on many different levels. So, what is it that brought you into this career?
I think it was my aunts who were nurses that. In the back of your mind when you're little, you want to do this, you want to be a doctor, you want to be a nurse. But I had two aunts that were nurses, and one of which was in World War II. And I used to hear stories from her about how she took care of the wounded in France and how it was difficult because they didn't have a lot of supplies. And just listening to her speaking about that, I thought, I want to be able to do something like that. But of course, I wasn't in war, but at least I did try to help people and try to make do if I didn't have supplies.
Yeah, sure.
Years ago, we didn't have a lot of things. So,
can you tell me, is there anything that in particular that reaffirms what the lifelong decision you've made here? Is it just simply what you do every day and working with your colleagues and taking care of folks?
Just the thank yous that I get from either staff, patients, even physicians. I mean, just thank you for helping me with this, or thank you for asking or answering my question, or thank you for just setting up things, or just being there, listening. I mean, how much of a reward that is just to hear that thank you.
Now, you've been here at St. Clair's since the opening, correct?
Correct.
Or pretty close, and I know you've had other positions that you've had within ministry, correct? And kind of taken on many different challenges for our organization. Can you kind of walk us through your career with ministry?
I originally started at St. Michael's in Stevens Point, and actually I went to school in Mercy in Oshkosh, so I've been with the nuns for many years, the sweet nuns.
Yeah.
And when I was at St. Michael's, I had the opportunity to first start on the surgical unit. And then I thought, I need to broaden myself. So I worked on the medical unit, ICU, ER, and PEDS. Yeah. And the only place I didn't get is OR. I wasn't really interested in that. And I even did some PACU stuff. Yeah. And so I just learned over the years, and it was fun. Yeah.
So finally, I guess... you see a lot every day, and as much as things change, how much does that impact the pride that you take to be able to, you've really adapted a lot along the way from where you started to what you're doing now in an environment like a brand new hospital. It's got to be a great, exciting for you.
I had to learn how to use a computer, so it was a challenge, but it was really. It was fun because it was a challenge. It was still learning. If you stop learning, you stop living. And I love learning, And yes, I'm looking towards retirement in a few years or whatever, but I'm not going to stop learning.
All right. Well, I guess on behalf of everybody at St. Clair's and everybody at Ministry Healthcare, congratulations, and thank you for what you do in keeping patients first.
Thank you very much.